What is Onapgo? Onapgo, apomorphine hydrochloride, is a wearable infusion device used to help relieve motor fluctuations in adults with advanced Parkinson's disease. Onapgo delivers a continuous infusion of apomorphine under the skin for consistent control of intermittent episodes of poor mobility called off episodes of Parkinson's symptoms during the waking day. Off episodes in Parkinson's disease, PD, refer to periods when the effects of medication wear off, leading to a return of motor and non-motor symptoms. Onapgo infusion works by acting on dopamine receptors in the brain, mimicking the effects of dopamine, a neurotransmitter that is deficient in individuals with Parkinson's disease. By continuously activating these receptors, Onapgo helps alleviate motor symptoms such as tremors, rigidity, and bradykinesia, slowness of movement. Onapgo mechanism of action is thought to be stimulating D2-type receptors, dopamine receptors, within the caudate putamen in the brain. Onapgo is from the class of medicines called dopamine agonists. Onapgo FDA Approval and Clinical Trials. Onapgo FDA approval is to treat motor fluctuations in adults with advanced Parkinson's disease was received on February 4, 2025. FDA approval is based on positive results from Study 1, NCT 02006121 Toledo, a Phase 3, double-blind, placebo-controlled study. The clinical trial demonstrated Onapgo patients had a 2.6-hour reduction in off time per day compared to 0.9 hours with placebo. 2.8-hour increase in on time, good motor control, compared to 1.1 hours with placebo. Common Onapgo side effects. The most common side effects of Onapgo are lumps at infusion site 44%, nausea 22%, sleepiness 22%, infusion site redness 17%, uncontrollable movements, dyskinesia 15%, headache 13%, insomnia 11%, dizziness 9%, low blood pressure 7%, weakness, lack of energy or strength, asthenia 7%, tiredness, fatigue 7%, constipation 7%, vomiting 7%. These common side effects occurred in 5% or more of Onapgo patients in the clinical trial Study 1. How should I use Onapgo? Onapgo directions. Keep the infusion site clean and use aseptic technique. Administer Onapgo infusion under the skin in one of the following areas: abdomen at least 2 inches away from the navel, top of thigh, lower back, upper back, only when the infusion site is being prepared by a caregiver or healthcare provider. Change the infusion site every day. Do not select an infusion site that is bruised, has bumps or nodules, or is irritated. A new single-dose cartridge and cartridge holder should be used each day. Discard the unused portion. Onapgo dosing information. Onapgo, apomorphine hydrochloride, is given as a subcutaneous infusion using the Onapgo pump. Daily dosage. The daily dosage is individualized based on patient titration. It consists of a continuous infusion and extra doses as needed. The maximum recommended total daily dosage, including both continuous and extra doses, is 98 mg per day, typically spread over 16 waking hours. Continuous dosage. The recommended starting dose for continuous infusion is 1 mg per hour. The dose can be increased as needed in increments of 0.5 mg per hour to 1 mg per hour. Adjustments can be made daily or over longer intervals. In clinical studies, had a mean dose of 4 mg per hour. The maximum continuous infusion dose is 6 mg per hour, administered over 16 waking hours.